Hello, ladies and gentlemen. This is Dr. Salma. I want to talk about the test called the urine analysis. Urine analysis. Analysis of the urine is useful because the urine contains many substances whose level can reflect the state of the internal environment of the body, or even part of the external environment. So the components of the urine analysis are: one, the the specific gravity. The specific gravity is a measure of the density of the urine. Okay, so if the urine is very dilute, like in a situation where there's so much water components in the urine, the specific gravity, if the urine is very dilute, that is there's too much, the water component of the urine is too much. Okay, there will be a low specific gravity. It will be less than 1.05. It will be less than 1.005. That is a low specific gravity of urine. An example is that when you have a low specific gravity of urine is diabetes insipidus, where because of the lack of the hormone ADH produced by the posterior pituitary, the failure to absorb urine and water and in the collecting tubules of the kidney, and then the person discharges a lot of water in the urine, and it will be very dilute. So it's a kind of diabetes. There's a lot of water in the urine. Okay, and this has implications. The person's osmolality will be raised. The level of solute concentration in the person's blood and the extracellular fluid will be high. It could be higher than normal, and that's the problem. It's higher than normal. And then, so also you have diabetes insipidus because of the collecting tube will not be sensitive to ADH, in which case the person may have mutated ADH receptors in the collecting tube. These receptors from being abnormal may not respond to ADH, so the person will be losing water in the urine. Okay, so you can see this one condition. This is the one where the specific gravity can be very, very helpful in making diagnosis. Okay, if the person is dehydrated, the specific gravity will be high. Okay, it will be high. So by just looking at the specific gravity of you, you can tell the level of person's hydration, and also tell of whether you want that the person may be spending too much water in the urine. Now, another component of the analysis is protein. Proteins are not supposed to be in the urine. Therefore, in some conditions, protein could appear in the urine. Like if the person has a febrile illness, there could be protein in the urine. If there's a urinary tract infection, the inflammation of the urinary tract could cause proteins to be released into the urine. Okay. Yes. Then some renal conditions like nephrotic syndrome. The problem is principally the loss of protein in urine. So the loss of protein in urine can be beyond just the component of or an effect of the disease. An effect of the disease it could actually be the principal problem of the disease, the principal abnormality in the disease. In nephrotic syndrome, there's lots of over 3.5 grams of urine of protein in urine in 24 hours. Over 3.5 grams of over 3.5 grams of protein in urine in 24 hours. So this leads to a low level of protein in the blood, and then and this will reduce the ability of the blood to hold water as it traverses the tissues. So the water will be the blood. So through osmosis, the tissues will draw water out of the blood, and you will not have swellings like in the feet and other parts of the body that are dependent. So this is called edema. So in the protein syndrome, the main abnormality is that the kidneys are leaking protein excessively, and then there's a reduction in clotting pressure in of the blood, and water is leaks out of the blood into the tissues. So you can see that the protein level is very important. You can see that leaking of protein, checking of protein in urine is very important. And then one condition in pregnancy called preeclampsia, protein in urine is very important. It's very important in its diagnosis. This is a condition where the BP, the blood pressure, rises in pregnant women, and may cause a major convulsion that may lead to death. So it's one of the fatal conditions of pregnancy. It's one of the fatal conditions of pregnancy. So checking for proteins is very important. It's important in achieving the diagnosis of preeclampsia or eclampsia, because in any antenatal clinic there will be protein. The women are tested for protein in the urine. So it is done in antenatal clinics. When the women visit, they see urine sample is taken and checked for protein, so that preeclampsia can be detected on time. Okay, so if the woman has high blood pressure in pregnancy and there's no protein in urine, that's not preeclampsia. You would expect a woman to convulse and possibly die. But if there is protein, you will expect that you know that this is a really serious situation. This woman can convulse and die in this pregnancy. Okay, so that's how important protein in urine, checking protein in urine can be. It can be a matter of life and death for pregnant women. All right, so those are examples of situations where the protein is checked for in urine, or those are situations where there's benefit for checking for protein in urine. Okay, so another something else that is checked in urine is glucose. Glucose should not be in urine because it's completely absorbed in the proximal tubule of the nephron of the kidney. So if glucose is found in urine, it's one of two things. It is that it could be that person is diabetic and the blood sugar has raised above 200 milligrams per dl. Okay, or there is a syndrome of losing glucose leaking in urine into urine in the kidney is part of the syndrome. The one is called Fanconi syndrome. It has glucose is leaked in urine, and amino acids are leaked in urine too in Fanconi syndrome. Okay, so checking for glucose in urine is very useful. It can point to diabetes. It can point to Fanconi syndrome. It can point to gestational diabetes. That's the diabetes that happens in pregnancy. Okay, so that's important. So checking for glucose in urine is important. Another thing I check in urine is leukocytes, white blood cells. White blood cells should not be more than 2 or 3, more than 5 to 8 per high power field in urine. White blood cells should not be more than 5 to 8 or 5 to 10 per high power field. That means if you look down the microscope, checking the urine sample, you should not see more than 10 white blood cells. If you see more than 10 white blood cells, it suggests to you that there's an infection in the urinary tract. The white blood cells are there to fight an infection, and therefore you are seeing white blood cells in excess in the urine. Okay, so white blood cells in the urine, leukocytes in the urine, if it's too high, suggests there's a urinary tract infection. And then, so other things that check in urine include nitrates. Nitrates in urine suggest there's an infectious process going on in the urinary tract. Ketones we see in the urine when the person is starving. Like if the person comes to my clinic and I see his his urine sample, the results, and I see ketones, is often it just tells you the person has not had his breakfast. So often, if a person comes to the who comes to the doctor who hasn't had a breakfast, to have ketones in the urine, but it could be more sinister. Ketones in the urine could be a sort of diabetes, uncontrolled diabetes. That's getting out of hand such that the person is developing acidosis. Okay? Like when a diabetic develops an infection, the blood sugar control will go out of control because the insulin insulin demand has increased and the person is not aware. Okay, so the person may now develop acidosis, and the ketones are the principal acid compound in this acidosis. It's called diabetic ketoacidosis. Diabetic ketoacidosis. So ketones are the important are the principal acid substance in this condition. So they will appear in the urine. The diabetic ketoacidosis is one of the life-threatening conditions of the diabetes. It's one of the causes of diabetic coma. Okay, so seeing ketones in the urine of the diabetic is sometimes you take it very seriously. Alongside, when you see this, the person usually will be weak, dehydrated, has a lot of fluid, the blood sugar will be very high. Okay, the person will also be hot from an infection or from malaria. So it would imply that the person's electrolytes are deranged. That something like potassium could be very high in the person's blood. Okay, so there's it's a serious control in diabetes that needs to be properly treated to see the patient and to be life-threatening. So ketones in the urine is important. It can tell you that the person is not eating, or it can also tell you that the person the diabetic is in serious situation, an emergency, and you have to do the proper things to turn the situation around. So, something else I checked in urine is blood. Okay, the blood should not be found in urine, but sometimes blood is found in urine. Blood will be found in urine when there's a urinary tract infection. So the blood will be from inflammation of the urinary tract. The blood will also be found. Blood will also be found in when there is inflammation of the kidney, in nephritis. In nephritis is an inflammation of the kidney. So there are different types of nephritis. Okay, and all the nephritis, all the nephritides are serious conditions because they could cause the kidney to fail. Many of them with time will cause the kidney to fail, and all of them are hard to treat. And with time will cause the kidney to fail. So the nephritis are usually manifest with blood in the urine. Okay, apart from that, they also show protein urine too, and then high blood pressure, raised blood pressure. So urine is important in making a diagnosis of nephritis. Okay, it's very important. It shows you blood and shows you protein. Then the other tests will show other things. Okay, biopsy could be useful to make to characterize the particular nephritis that the patient has, and ultrasound will also help too. You will check for short abnormalities in the kidney, like polycystic kidney disease. Polycystic kidney disease will also show protein and blood in urine because it tends to bleed, and it also causes hypertension, another cause of protein in urine. So polycystic kidney disease is a condition where the kidney has many cysts in it, many fluid spaces in it, which occupy the space of normal parenchyma, normal kidney tissue. Instead of normal kidney tissue, you have space of collections of fluid in the kidney. This kidney is very enlarged in size. Eventually, the kidney will lose function. Eventually, the kidney will lose function, and then the patient will be in renal failure. Okay, or it will be kidney failure, and then because this condition also causes hypertension, that's another kidney damaging condition. So protein urine and blood. So blood urine could be caused by, it will make your doctor think of the possibility of polycystic kidney disease. And then, okay, so that is it. So that is it. So a polycystic kidney disease is also prone to be infected, which will lead to which will then be called a pyelonephritis. The kidney will becomes infected with bacteria. And then in the urine, you now see, apart from protein and blood, you also now see leukocytes, white blood cells. And another thing I checked in urine is urobilinogen. Urobilinogen is a component of results from processing heme. A component of hemoglobin. The component that carries oxygen in red blood cells. So when there's a breakdown of red blood cells, a high level of breakdown of red blood cells, the urobilinogen level will be raised. Okay. So also bilirubin, the excretion product of heme the component of red blood cells that has iron in it, which binds oxygen. Okay. If one is broken down, the end point is hemoglobin, is bilirubin, which is excreted through the kidney. So if you see bilirubin in urine, so it suggests you that you have a high level of hemolysis, red blood cells being broken down in the body, like in malaria, like in sickle cell anemia. Okay. Alright, or maybe also an infection, sepsis can cause a breakdown of red blood cells and result in bilirubin in the urine. So those are a few things that are those are some components of urinalysis. A doctor will do that when your doctor does this test. You check all these things, and they will help him have a clue of what is going on in your body and help him get a diagnosis. Alright. So thank you very much.